All right, well, good afternoon, everyone, and welcome to today's joint webinar between ISACA New England and Wolf and Company PC titled Navigating HIPAA Compliance for Healthcare Providers and Health Tech Organizations. This webinar is worth one CPE, and in order to ensure timely and accurate crediting of CPs, please ensure your full name is set as your display name. I've pinged a few of you folks so far to either ask for your full name details or to update it in Zoom if able. There should be a little option over your video box or an ellipsis somewhere. Not sure what it looks like as an attendee where you're able to rename. But if not, just shoot me a direct message here in the chat function with your full name, and I'll make sure you folks get credited for those valuable CPEs. Julie's presentation today will be around 35 or 40 minutes or so. Please feel free to leverage the Q&A button to post questions throughout the webinar. That way I'm able to see if they've been answered or not and mark them accordingly. The chat functionality is also enabled because in the past we found that folks may want to share ideas and thoughts amongst the other attendees, which has some value. Otherwise, Julie will do her best to answer questions throughout the topics while it's relevant. If not, we'll have plenty of time at the end to answer any and all questions you folks have or address any feedback. Like I said, we'll have around 35 to 45 minutes to present with a 10 minutes for Q&A. We have the full 2 p.m. block. I know we started late, but should have plenty of time to hear all the great things Julie has to say and allow sharing of ideas between all you fine folks from ISACA New England. At the end, I will send a survey link. I'll ping it now in the group chat, but I'll make sure to also send it at the end. Just want to collect feedback regarding you folks as to how we can make these surveys better in the future. I think feedback number one, actually include the password with the link. So I think I got that one figured out and I'll make sure to resolve going forward, but happy to hear any and all thoughts that you folks have to make sure that we can do a good job of sharing information with you folks going forward. So without further ado, I'm going to introduce Julie and then hand things over to you, Julie. But otherwise, Julie is a manager here at Wolf & Company based out of Boston, specialized in information technology assurance services. Her primary focus is on healthcare companies and high trust certifications. With a wealth of experience, she leads and executes IT audit services and consulting for clients in various sectors, of course, for healthcare, but also the financial and technology sectors. So without further ado, Julie, pass things over to you.
All right, great. Thank you so much for that introduction, Todd. So like Todd had said, this is navigating HIPAA compliance for healthcare providers and health tech organizations. My name is Julie Fougere, and I'll be your presenter today. So Todd touched on this a little bit about me. I'm an IT assurance manager within the risk management group at Wolf & Company. I've been with Wolf & Company for over 5 years. And I did start out within the banking and financial institution world, so completing IT reviews such as application reviews, business continuity reviews, incident response reviews, pretty much any general control review. Within my first year here at Wolf, I quickly learned that healthcare related work was the most challenging and most interesting. So I quickly pivoted to specialize more in healthcare related reviews. So like this presentation today, HIPAA security reviews, NIST benchmarking, and then a special interest in high trust certifications. So what's interesting about healthcare is that although there are rules and laws in place for HIPAA, it's not as heavily regulated in comparison to banks and financial institutions. So this causes, a lot of security controls to slip through the cracks. So when we come in and we help these healthcare organizations, a lot of the time they're pretty thankful that we're there and being a good partner to them. It's less of, I'm an assessor coming in and I'm checking in on things, and more I'm a partner to help you guys guide you through to the best practices for security in your organization. We all want the same thing. We want to make sure patient health information is as secure as possible. So I know, looking from the attendance, today's group looks to include, people from all different types of backgrounds, people that might come from an auditing field background like myself, and then others who might be part of an organization that's looking to become HIPAA compliant. So please, if you have a question, like Todd said, feel free to use the chat box or use the Q&A section. I'll try and get to them as slides go through if you have a question about specific content. But anything I miss, I'll answer at the end during the question Q&A time. So stick around. Also, as a note, I am presenting today with a very excited puppy. So if you hear any noises in the background, that's him. All right. We're going to hit a couple different topics today related to HIPAA compliance. So the first being HIPAA Essentials, where we're going to break down some basics of what HIPAA compliance is and who it's required for. Moving on to how to cultivate a culture of HIPAA compliance at your organization. And then some common compliance challenges that I see. You know, we work with a lot of different organizations, both size and complexity of their environments. So it's pretty easy for us to pinpoint, you know, major challenges that a lot of organizations face. Moving on to the next section, which is going to be how to account for our ever-evolving landscape of healthcare data threats. Just, you know, touches on updates in the organization industry, things like that. And then rounding out today's review, some complementary frameworks that go along pretty well with HIPAA compliance. All right, so what is HIPAA? HIPAA stands for the Health Insurance Portability and Accountability Act, which is a federal law protecting health information. What it really does is govern how health information can be used and disclosed, is pretty much the basics of it. It was enacted by Congress in 1996 as a part of the Administration Simplification Act. And when it was enacted, it included two rules, so the privacy rule and the security rule. And they're still used today. Following 2009, they added the breach notification rule and the omnibus rule. Those were both added. During this presentation, we're going to be specifically discussing the HIPAA security rule, which covers the protection of any electronic protected health information, or as I'm going to relate to it a lot, is EPHI or PHI. So who needs to worry about this? Now, there are three main groups that are concerned with being HIPAA compliant. Covered entities, which include health plans, health insurance companies, HMOs, business associates, so any person or entity that performs functions that involve the use or disclosure of protected health information, and then basically any organization that handles patient health information. So covers pretty much the full range of different organizations and clients. So like I said, we're going to be focusing on the HIPAA security rule for this presentation, which can be broken down into three different safeguards. And those three different safeguards are their own categories. So up on the screen, you can see starts with administration safeguards, moves on to physical safeguards, and then the technical safeguards. So just starting off first with administration, they're going to include security management process, security personnel, information access management, and workforce training and evaluation. So examples of this safeguard are things like policies and procedures to ensure employees have appropriate access to EPHI, security awareness training for employees at organizations, contingency plans such as business continuity plans and disaster recovery plans, and then business associates agreements. So those are just a couple. That's not everything, but those are the major sections that makes up that. Moving on next to physical safeguards. I mean, it's in the name. It's all going to be about the physical safeguards for your physical facilities. So if you have wherever your data is hosted, that's in scope, or if you print out paper copies or any documents that show EPHI, that's all going to be in scope. So wherever the buildings are that you store those documents. So examples of physical safeguards are going to be, you know, locked doors for your facilities, surveillance cameras, on-site security guards and alarms, things like that. All right, for the last safeguard category, we have technical safeguards, which include access controls, audit controls, integrity controls, and transmission security, which examples of those are going to be things like regulating access to EPHI. This is going to be a lot to do with the access control section of that, role-based access for accounts that access EPHI, proper identification before accessing EPHI, and encryption for that EPHI. So where do you start? This can be a big project to take on, especially for smaller organizations, which is why the very first step I always recommend is to make sure you have that leadership buy-in. That's the foundation of the compliance pyramid, right? Because this ensures not only will you have the internal support that you need to start your HIPAA compliance journey, but sometimes your financial support as well. I mean, we all know that half the battle for getting projects off the ground is making sure you have the budget to perform some of these implementation asks, or maybe even hiring a new person to start up a team for this project, things like that. Moving on to the next level of compliance in the pyramid is ensuring that employees are trained not only on HIPAA requirements, but also on proper cybersecurity in general. I'm going to talk a little bit about this more later. Moving on to level 3 is to develop and maintain policies and procedures for your organization, specifically information security policies, although this extends into more technical procedures like vulnerability management procedures and incident response procedures. This might seem like a small step, this paper exercise, but truly outlining the policies and procedures in which you have standards for your organization is only going to help you in the long run, especially if you have employee turnover and you want to make sure things are done consistently and accurately for your organization. Lastly, rounding out the pyramid is maintaining regular audits and monitoring to make sure continuous improvements are being made. This would be things like annual HIPAA security reviews, vulnerability scans completed by outside third parties, or even penetration testing, things like that. So my line of service, I work with a lot of different organizations going through HIPAA security. So different sizes, different environments, things like that. So I get to see a lot of reoccurring objectives that the majority of those organizations have a hard time implementing, whether they don't have anything in place for some of these things, or they just need to make, massive updates in order to be compliant. So that's what we're going to talk about next. Objectives such as ongoing employee training, vendor due diligence and monitoring, business continuity plans, and risk assessments. Those are the top 4 that I see. So starting with the first, ongoing employee training. Who needs to be included in HIPAA security training? So at a minimum, it's any employee who's going to be handling PHI is what I would require for completion of this testing. But best practice would be any employee at the organization, right? You want to make sure you have a well-encompassed ongoing training program. Easiest way to do that, make sure everyone's following the requirements that are being asked for HIPAA compliance, is to make sure everyone's doing that ongoing employee training. So what do these trainings need to include? First step is obviously definitions. You hear me talk a lot about PHI, EPHI, and HIPAA. Those are all acronyms. So laying them out in definitions for these terms is going to be the first step to make sure everything is clear for all employees. Including why it's necessary to protect the privacy of patient health information is one of the biggest parts. If they don't know why it's necessary, they're not going to pay attention. They're not going to pay as much attention to the training and really get their buy-in as if they know what their importance of keeping up with this training, keeping up with HIPAA security within the organization. It's going to go a long way. And the last is how employees can do their part to protect EPHI. So kind of sending them off with a message of, how can you, besides just going through normal annual training, how can you in your everyday life protect PHI at the organization? And last is how often do these trainings need to occur? So upon hire and annually thereafter is the recognized cadence, and it's the one that I recommend to all organizations. It's pretty cut and dry there. I'm sure all of you guys work for organizations that require some sort of training annually. That's the ask that we would ask for security awareness training as well. So working in this industry, it definitely allows me to meet a lot of different people, a lot of different organizations. And one of the things that I don't see that often is a chance to add some creativity into their line of work, right? Security is pretty cut and dry. But when I do see creativity, it really sticks with me. And this is one of the topics that I can say, you can be very creative with this. You want to engage your employees. You want to make sure that they are understanding what HIPAA compliance is and the importance of it. So one of the stories I like to tell is I have this one client that chooses a theme to base their annual Cybersecurity Awareness Month campaign on, where they dress up as a team, the security awareness team. They dress up as a theme and they walk around the organization and ask employees security awareness questions for a prize. So this year it was the Wizard of Oz. They all get dressed up, they walk around their hospital. In previous years, I've seen, Star Wars, Beauty and the Beast. One year they even went as fishermen to, really showcase the risks of phishing scams at the organization. And by doing these fun awareness campaigns, the organization is able to give a face to the name in the security department, right? They're not just some people behind computers where if you're having an issue and they're really hitting home that you need to make sure you do those security awareness trainings. It shows that it's not just the security department that needs to be concerned with cybersecurity. It's a group effort. It's the organization that should be concerned. So moving on to the next objective, we see organizations struggle with its vendor due diligence and monitoring. So I've broken this up into two different sections, one on vendor due diligence and risk assessments, and then the other on, ongoing vendor monitoring. Now, not only is this the top challenge I see organizations struggle with when going through HIPAA security reviews, but in my opinion, this is the most important step to securing PHI properly. If any secure data or PHI is being sent to a third party, that group should be properly vetted. It should be consistently reviewed, and then that way you're ensuring that they're keeping your data secure. So starting off on the left-hand side, we have vendor due diligence and risk assessments. They're typically completed before working with a new vendor, supplier, or third party, and they're used to assess the vendor's operational stability to gauge any potential risks for your organization. All of that due diligence is then cycled through to create a vendor risk assessment, which is there to identify and evaluate, potential risks that vendor might have on your organization. That end deliverable would be a comprehensive vendor risk assessment, lining up the risk ratings per vendor. So, some vendors go through due diligence and they're labeled a low risk vendor. Some are labeled a high risk, some are in the middle. So all of that will be used, that risk rating system for the vendors will be used for the next section, which is vendor monitoring, which is performed sometimes mostly on an annual basis, but it's going to depend on your vendor risk assessment, right? So high risk vendors annually, maybe a low risk every 2 years. That's all up to you to determine, but for the most part, I see on an annual basis. This ensures that thorough vendor reviews are being performed and that your risk assessment is up to date. So documentation from the vendor would be a part of this vendor monitoring. You might ask on an annual basis for a couple different things, such as the vendor's most recent SOC report, maybe business continuity plan testing results, maybe even vulnerability and penetration test results. But the most important part of all of this is going to be the review of those reports, not just asking for them, but when you get them in, actually looking through them. This is one of the top things I see organizations miss. They might ask for a SOC report, but they're not performing that formal review of the report itself, right? What is it? What does the report say? What are the gaps found from that vendor? And then the very last part towards the end of the SOC report is where they put any complementary user entity controls, which outlines, the vendor has a certain understanding of what they are being asked to do. And they also have an understanding at the end of the SOC report for what the customers using the vendor's technology is responsible for. This might be access controls. So if you, the organization, are giving access to your employees for this piece of technology and the vendor has no part in it, that would be on you guys. That would not be on the vendor. So just being aware of those things is proper procedure, especially for HIPAA compliance. Moving on to the next challenge. So we often see a lack of a business continuity plan, or a BCP is what you might hear me call it. So it's a comprehensive plan that outlines the procedures an organization will follow to ensure essential business functions can continue or resume in the event of a disruption. This will most of the time, if not always, include business lines in each of these BCPs or all in the same BCP to create that comprehensive plan. The next section is what's called a business impact analysis, or a BIA, which assesses the potential impacts that various events or disruptions might have on your business operations. So the goal of a BIA is really to just understand the criticality of different business processes, functions, systems, things like that, in order to prioritize them based on their importance to business continuity, to make sure that you can get up and running. Some technologies are definitely more important to prioritize business continuity than others. So that's what would outline it. Now, the last section is all about testing. So once you have your comprehensive BCP in place, testing is then required to ensure the plan not only includes, all the areas needed for business services to get back to normal, but that it actually works, right? A disaster is not the time to test your BCP. That is most definitely not the time. So testing is typically completed on an annual basis, and it normally falls within 3 main groups. So tabletop exercises, structured walkthroughs, and then full disaster simulation testing. Oh, it looks like we had a question on the last slide. So should user organizations request SOC reports from their service providers or sub-service organizations? So yes, that is a great question. I would say yes, that is one of the key aspects of what you would want to look at for your vendor management. So yes, you would request your SOC report. And just so you guys know, if you have a good compliant vendor, they're going to be getting those SOC reports on an annual basis. So you're going to want to be asking for them also on an annual basis. A quick message to whoever is your liaison with that vendor saying, hey, it's that time of year again. Do you have your most recent SOC report provided to you yet? Or when do you think that's going to occur? And then taking that in and doing that review that I had mentioned before.
To add on that note, Julie, and that answer makes all the sense in the world. Not all sub-service organizations that are carved out of your primary service organization's report are created equally. One may be the data center that's used purely for disaster recovery capabilities versus maybe it's a third party that's actually assisting with some of the transactions or business activities that are key to your relationship. So I think it's important to, one, evaluate any, if all, of the sub-service organizations that are relevant to your relationship, the nature of the technology that you're using, because even further, you may have noticed that some SOC reports cover dozens of technologies from that one vendor. So one of those sub-service organizations may not be directly relevant to the service you're using them for. But I think the important part, like Julie was saying, is doing that analysis, making that determination if they are relevant, and then working with either your sub-service organization or the user organization themselves, service organization themselves, to try to obtain that. Because you folks do have that right to ask that question and go down that path. Thank you, Julie.
Of course. Thank you so much, Todd. Yeah, to reiterate what Todd said, definitely the most important part, you'd see that it broke up other technologies just by reading through it. It can be a little dense, but there's some key information in there that should be reviewed. All right, so that covers business continuity and vendor monitoring and management. Moving on to the next one, the last of the challenges that I see relates to risk assessments, which I particularly mentioned back during vendor due diligence, but this relates more to technology risk assessments. So there's 2 questions I focus on when discussing IT risk assessments with clients. It's going to be, what is an IT risk assessment and why do you need it? Why should you guys have one? So going back to the other challenges we just spoke about, vendor management, business continuity, they can be expensive projects, not only to make sure you have dedicated teams to carry them out, but also Making sure if you have to have someone come in and create a business continuity plan for you, that's going to cost a pretty penny. So by having an IT risk assessment, it documents a full breakdown of where your risks lie and the level of the risk they pose to your organization in order to form ratings. You can use this then to present to leadership and get additional resources that you might need for a team project or budgeting. So what is an IT risk assessment? An IT risk assessment focuses on identifying the threats facing your information systems, networks, and data, and then assessing the potential consequences you'd face should these events ever occur. Why do you need an IT risk assessment? Well, it gives you a concrete list of vulnerabilities within your organization. It gives you a comprehensive risk rating for all the aspects of your organization's environment. And then additionally, like I had said before, it can be used to request additional resources or budgets that you might need to make improvements within your organization. So what are the key steps to take when starting out with an IT risk assessment? I've broken them down into 6 different steps, so we'll kind of go one by one for each of these. First step is obviously to identify and catalog all your information assets. This gives you, full transparency into your environment to show you the full picture. You then identify the threats and vulnerabilities to those information assets and your organization in general. Then you'd start by analyzing any current internal controls that you have in place that could mitigate the risks of any of those identified threats or vulnerabilities. And then following up with that by determining the likelihood that an incident might occur within your environment or any of those identified assets. The last few steps are going to involve assessing the impact of a threat. So not all threats are created equal. Some are maybe lower hanging fruit. Some are definitely higher level threats. So having that assessment to the level of impact is very important in actually generating the risk assessment. And the last step is designing controls to mitigate those risks. So really writing out the design controls and documenting the results of all the above steps into a formal risk assessment. And like I had said in the slide before, again, this is going to be an annual process. You don't have to start from scratch every single time, but monitoring it and making sure if updates need to be made, or at least having a third party come in to review your risk assessment is required. So the next topic I'm going to talk about today is evolving healthcare data threats. Now, I don't know that any of you guys have looked through the 2020 healthcare breach report, but I definitely have. And in it, we've seen that the number of data breaches are on pace to be the lowest since 2019, which sounds fantastic. However, with the total number of breaches being lower, we're seeing a significant uptick in the size of these breaches. So the amount of people that are actually affected by healthcare breaches in general. So how can we stay up to date when healthcare data threats are ever evolving? It's by a couple different processes, but the 4 main points are by continuous risk assessments and regular security audits. So on an annual basis, having a third party come in and perform a HIPAA security review for you, perform a review of your risk assessment, things like that. By staying informed through threat intelligence sources, such as those annual breach reports, the Verizon breach reports, anything like that. Participation in professional security associations. So that would be things like these ISACA webinars, making sure to stay up to date on any emerging threats within your industry. And then last is finding a trusted partner to help you through your annual HIPAA security review. So when I say that last part, it's not just someone to do a HIPAA security review for you, but to really be a trusted partner to let you know, this is what we're seeing in the industry. This is what we're seeing with similar clients to your size. You might want to consider looking into these different reviews, maybe a BCP review, maybe it's, a NIST benchmarking review to really get your organization set on a framework, things like that. So the last section that I'm going to talk about today is complementary frameworks. So you've decided to complete a HIPAA compliance review, or you've recently completed one. what are some complementary frameworks that are often seen paired with a HIPAA security review? So let's see. So this is by far the top review we see paired with a HIPAA compliance review is a Service Organizational Control or SOC 2 report. This is mainly because, they include a lot of the same control areas, just because the trust service criteria framework, which is what makes up a SOC 2, is very well mapped to the NIST cybersecurity framework, which is, what most HIPAA security reviews are based off of. It's definitely what we base ours off of here at Wolf. So a SOC report provides an independent validation over a company's controls, and it's used to provide reassurance that proper security measures are being taken. They're also frequently paired with HIPAA security reviews because you'll find that the requests are either similar or they're pretty much the same. So by pairing them at the same time and having an organization come in to perform a SOC review and do a HIPAA compliance or a HIPAA security review, it's a little bit less of a burden on your internal departments, right? Because instead of having to provide the same documents twice in 1 year, they're just sending them over at once. And then there's that knowledge share between the two departments performing the HIPAA security review and providing a SOC report to you. The last complementary framework is HITRUST CSF or a HITRUST certification. So after you go through HIPAA compliance and you have a SOC 2 report, what might you do next? As I said in the beginning of this presentation, I specialize in healthcare related reviews, and I specifically, specialize in HITRUST certification. So setting clients up to get HITRUST certified and actually helping them through the process of submitting to HITRUST and getting that validation back. So it's definitely my bread and butter. So if you don't know what the HITRUST CSF is, it's a comprehensive framework that incorporates various security and privacy standards, including HIPAA, NIST, ISO, PCI, and more, which is why it's a great next step. And it's broken down into 3 different assessment types. So if you don't think you're ready to just jump head into a HITRUST certification, there's different assessment levels that really will meet your organization's need. So they're almost like building blocks. Think of like a Russian nesting doll. They all kind of nest into each other. So it starts out with the E1 assessment, which is 44 control requirements. It's fairly small. It's definitely the foundation of all of these assessments. And it serves as the first stepping stone in HITRUST certification. It basically makes sure that you're maintaining good cybersecurity hygiene. It's definitely the lowest of all of them. Making their way into the middle tier is the I1 assessment. So it includes all the 44 control requirements from the E1, it adds additional 138, so it totals to be 182 control requirements. This provides for, a moderate level of assurance that addresses any cybersecurity leading practices, and it's definitely a more rigorous evaluation than the E1. The last of these assessments, and definitely the most, rigorous, the highest level of assurance, is the R2 assessment. So it's upwards of 182. It's going to range between 200 and 900 controls. 900 is, think like the AWSs and the Azures of the world. They have the highest, highest level of assurance and the highest level of controls because they're so large. And it's a comprehensive risk-based collection of controls used to provide that high level of assurance. So before I move on, I'm just going to make sure no more chat questions. So the key takeaways, what are the key takeaways from this presentation? It's going to be, making sure you understand what HIPAA is, making sure you understand what are the challenges that I might face as an organization going through HIPAA compliance. What are the different, aspects that I need to consider when it comes to onboarding my new employees or keeping up with their training? And then last, what's the next steps I have after I get HIPAA compliant? What can I aim towards for the future in different complementary frameworks? All right, so that was the key takeaways. And this one I missed, but making sure that you're up to date on any of the evolving data threats through breach reports, things like that, any threats that our industry faces. So that concludes my presentation today. Thank you guys so much for taking the time to listen in. Again, my name is Julie Fougere. If you have any questions regarding HIPAA or any of the content we covered today, please stick around. We're going to do a question and answer session. Or if you can't make it and you have to drop, please take down my email address. If you have any questions at all, feel free to send me an email.
Wonderful. Thank you, Julie. Really well done. I don't see any additional Q&As right here in the Q&A field, but if folks do have some questions, feel free to post them. I think I should be able to allow you folks to speak if you wish. Don't hold me to it, but please feel free to spend a couple minutes asking some questions. If not, you know where to find us. Julie's email was shared. We will send out this PowerPoint presentation in short order after this meeting wraps up. In a few weeks, we submit this recording to YouTube so that you folks can replay it anytime you wish or share with any colleagues that may be interested. There is a question that just popped up, Julie, so thank you for that question. Please keep them coming if you wish. And are there state-specific HIPAA requirements, Julie?
Yes, that's a great question. So according to HIPAA law, no, it is a based framework for all states. So there are no specific HIPAA requirements, whether you're from Mass or Texas or anything like that. But where that comes into play are going to be the more rigorous frameworks like high trust, like I was mentioning. There are certain things you can add in that are strictly Texas-based requirements or Massachusetts. Those are the ones I typically see, just in case you want to go look those up. But no, there are no HIPAA requirements state-specific. That's a great question. Let's see, it looks like another one popped.
If you folks have anything else, Christo, you reminded me, and I just pinged it here in the chat, but we will send out as well, is, as I alluded to at the beginning, there is a Google survey link. Please feel free to reply. Would love any and all feedback regarding how we can improve these webinars in the future. Any other questions from you folks at this point? Otherwise, sincerely appreciate your patience in the delayed start. Thank you for joining us today, and thank you for listening. So maybe if that's it, Julie, we could say goodbye. Thank you. Oh, James, all right, at the buzzer.
So his question is, how important is it that all entities that would be considered a business associate have a BAA in place? And should you focus on the most important third parties to get a BAA or just get all of them? That's a great question. You know, in a perfect world, all of them. That would be where I would start. But I know that can be a lot to take on for a small organization. So going back a little bit, when we were talking about the BAAs for organizations, that was a part of vendor monitoring, right? So that's going to be a part of the vendor risk assessment. You're going to want to make sure any vendors that you have rated as a high risk vendor, those are going to be the first ones that you want to make sure you have very strict BAAs in place that encompass anything that you would require for security, compliance that they would cover. So that's the first step. Obviously, I know in a perfect world, you'd have all of them have a focus on their BAAs, but that's going to be the first step, which is why the vendor risk assessment is so important. If I can stress one thing, it's vendor management.
Thanks for that question, James. And thanks for the answer, Julie.
Of course.
Christo, thanks for the kudos. Any other questions you folks may have? Peter, thanks for the question.
Perfect. So Peter's question is, are there any portable solutions that automate HIPAA as they are in SOX? So that's a great question. Now, I might need a little bit more clarification on portable solutions that help automate HIPAA, but for the most part, I don't want to bash HIPAA, but it is a little outdated. So yes, we could see certain requirements come in the future, you know, to offer different solutions, but I don't think it's the same as how SOX has those portable solutions to automation. Todd, I know you work with a lot of SOX. I don't know that you know what
No,
the
I
solutions are.
don't. I
Yeah, I
don't off
don't
the
know
top
that
of my
I've
head.
heard that in regards to HIPAA. If you have a chance and can reword or clarify that, I'd love to make sure I answered your question.
Peter, we can also talk to some of our colleagues and share any learnings we may have, but I unfortunately can't speak to any utilities or tools off the top of my head that could help manage
Yeah,
the compliance
HIPAA
process.
isn't, you know, like high trust framework is set by them, but HIPAA is a law. It's a federal in place law. So it's not like they sell a solution to get this done.
Thanks for that, Peter. Happy to talk more offline as needed. Otherwise,
Oh, a vendor portal such,
uh,
yes, okay. I see what you're asking now. So no, like I had just said, so HIPAA compliance is a law-based you know, regulation. It's not so much like a high trust where there's a portal and there's automation support through that. It's genuinely regulated through the vendors or through the assessors that you're going to be working with. And it's typically, like I had said in the beginning, going to be based off of NIST is what most organizations. All right, James, another question related to BAA. We said many vendors post generic BAAs on their website. If I use that vendor, can I leverage that document or must I have a signed BAA between my company and the vendor? So the best practice is always going to see that you get a signed BAA between you and your company. Having said that, because I work with high trust so closely, I know the trouble with trying to get huge vendors to agree to your terms and your BAA and agree to signing a specific BAA. So the best advice I can give is to really just try and work on making sure the requirements, the base requirements that you want in a BAA is actually in that. If it's in the generic one that's posted on their website, great. If not, at least doing your own due diligence to reach out to them to make sure it covers your basics is the best practice. Another great question, James. Thank you.
okay. We have a few minutes left, so maybe we can allow a little bit for folks to type if they have anything else.
These are all fantastic questions, though, I have to say.
Okay, maybe that's the last call, and we're glad we were able to make good use of our time despite the delay. Thank you once again, Julie. Thank you, everyone. Thank you, ISACA New England, and please be on the lookout for the slides, the YouTube link on the Wolf & Company PC page, and take care, everyone. Have a lovely Thanksgiving.
All right. Thank you, everyone.
Bye, everyone.